Hello students, welcome to Next Level Academy Step Up Your Career. Today we are going to see the continuation of the fundamentals of nursing questions, and this is part 4. So isometric exercise means, what's called isometric exercise? Imagine this is a face of a person. This person is giving a pressure, a force by his hand forward, and also he is giving a force by himself towards the opposite side. So at a time, towards the either side, he's giving a force. This is called isometric exercise. Okay, exercise. So this you can see a patient is having a cervical pain or something. Okay, this is a physiotherapy exercise which is performed by the patient, which is encouraged by the physiotherapist. So it's a good example. So isometric exercise means what? Muscle strength do not change. Muscle length do not change. Muscle length changes. Muscle tension rises and remains the same. Muscle length shortens. So what's the answer? So that here, can you see any length changes over here? No. So the answer is the A. Muscle length do not. So students, we are going to see the second question. Which of the following is used in the management of the hyperkalemia? First, we have to understand what is called hyperkalemia. It's nothing but the increased level of the potassium in the blood. So what is the normal range then? This is 3.5 to 5.5 milliequivalents per liter. Okay, this is the normal range. If it exceeds beyond 5.5, then you call it as hyperkalemia. So what happens actually? So in the intravascular cavity, potassium level will be increased. So to reduce that, what they do is they give some treatment, okay, intervention, which will shift the potassium level to the interstitial space. So what is that? Is it insulin with the glucose or sodium bicarbonate, potassium chloride or magnesium sulfate? Definitely they'll not give potassium chloride because already the potassium level is increased. So what happens? What if suppose if they give magnesium sulfate doesn't work it out, and sodium bicarbonate is relevant to the acid-base balance which is produced by the pancreas. So insulin with the glucose they provide. So the answer is insulin with glucose. So what happens over here? Suppose actually like if you give insulin actually it takes up the potassium level from the intravascular cavity, holds the so you can give directly insulin. But what happens? Suppose if you give directly insulin, the patient will go into hypoglycemia. Hypoglycemia. So in order to stop that, so they give glucose. Glucose they give it 25% glucose with 10 units of insulin. Together they give. So what happens? The potassium level, which is in the intravascular cavity, will be shifted to the interstitial space. And next, which of the following ECG findings indicates the presence of hypokalemia? Is it tall peak T wave? Is it the ST segment depression? Is it the widening QRS complex or prolonged PR interval? So what the ECG findings will indicate if the patient goes into hypokalemia. So suppose if the patient is having hyperkalemia, you can see this is a QRS complex and the patient will have tall T wave. You can see in the hyperkalemia. Suppose if the patient, okay, this you can see tall T wave, that's in the hyperkalemia. Now the question is hypokalemia. So what happens? ST segment depression, which you call it as ischemia, okay, a myocardial ischemia, and widening of QRS complex. So widening of QRS complex always you can see in the bundle of his problem, okay. And next is long QPR interval. This you can see in the first degree of the heart block or the AV block, atrioventricular block. So what is the answer? It's nothing but the ST segment depression. Okay, in the ST segment depression, you can see if the patient is having hypokalemia, you can see the ST segment depression. And what is the size of the intravenous cannula used for the neonate? Is it 18 gauge, 20 gauge, 22 gauge, or 24 gauge? Let's see the color which is used in the Indian scenario. For the 18 gauge is green color, and 20 gauge is pink color, and 22 gauge is blue color, and 24 gauge is yellow color. Okay. So you might have seen for the babies, yellow color is suggested. That's 24 gauge, which is used for the cannulation for the infant. And next is all of the following methods are used to assess the area of burn injury except. So you have to select here the wrong answer as the right one. So it's none other than the Parkland formula. What's called the Parkland formula? Parkland formula is nothing but the fluid which is given first 24 hours of the care for the burn injury. So it is all about the fluid, how much fluid it has to be given. Okay, it is not about the area of the burn injury. It's not about the area of the burn injury. It's about the intervention. It's about the fluid, how much it has to be given. The rest, Len Browder chart, rule of 9, Palmer method, this is used for the assessing the area of burn injury. Okay, thank you, students. If you like this video, please like, subscribe, and share. And if you want to join a course, you can join in our institute. We have given the contact number.